To begin CPR, position the victim on his back on a flat, firm surface. Support his neck and head as you move him, in case any head or neck injury is present. Keep his arms alongside the body and legs straightened. CPR saves lives in 3 progressive stages. These are the A, B, C of CPR. Airway management. Make sure the airway is kept open.
Breathing.
Breathing. Check for breathing and give 2 breaths if the victim is not breathing. And circulation. Check the pulse and perform chest compressions to keep the heart pumping until the pulse returns.
1, 2, 3, 4, 5. 1, 2, 3, 4, 7. 1, 2, 3, 4, 50. In an unconscious victim, the tongue may have fallen backwards, blocking the victim's airway. This prevents oxygen from getting to the lungs. Open the victim's airway immediately using the head tilt chin lift maneuver. Tilt the victim's head firmly backwards with the palm of one hand and lift the chin with the fingers of the other hand. Leave his mouth slightly open. Remove any loose foreign objects if present in the mouth. Check to see the victim is breathing. Place your cheek close to the victim's face and look for the rise and fall of his chest. Listen for sound of his breathing and feel for the escaping air from his nose or mouth on your cheek. If none of these are present, the victim is not breathing. If he is not breathing, begin mouth-to-mouth ventilation immediately. Maintaining the head tilt, pinch his nose with your index finger and thumb to prevent air escaping through the victim's nose while you breathe into his mouth. Take a deep breath and open your mouth wide. Make a tight seal over the victim's mouth and blow until you see the chest rise. Release the nostrils immediately for the victim to exhale. You should see the chest fall. Repeat the action straight away. Each breath should take 1.5 to 2 seconds. Each contains enough oxygen for the victim's immediate needs. This is called ventilation. The chest must rise and then fall as the air exhales. Otherwise, check that the head and chin are correctly positioned and that the airway is open. Next, slide your fingers down the side of the anus-apple until you reach the groove of the side. With gentle pressure, feel for the pulse of the carotid artery for 5 to 10 seconds. No pulse.
Begin chest compression if there is no pulse. With your middle finger, find the lower margin of the victim's ribcage on the side nearest you. Move the finger up to the notch at the center of the chest where the ribs meet the lowest part of the breastbone. This is the lowest point at which the hand can be positioned for chest compressions. Place your index finger next to your middle finger. Now place the heel of your other hand on the breastbone next to the index finger. Place one hand on top of the other and interlock your fingers, making sure that the fingers are off the chest wall. Extend both elbows and lock in position at right angles to the victim's chest. Use your body weight to compress the victim's chest by about 4 to 5 centimeters. Compressing the chest here actually compresses the heart between the breastbone and the vertebral column. This pumps blood to the vital organs such as the brain and the kidneys. After each compression, release pressure to allow blood to flow into the chest and heart. But do not lift your hands off the victim's breastbone. Count loudly as you compress.
1, 2, 3, 4, 5. 1, 2, 3, 4, 7. 1, 2, 3, 4, 50.
After every series of 15 compressions, deliver
2 ventilations. After the first 4 cycles of 15 chest compressions and 2 breaths, check for pulse again. Continue CPR until the pulse returns or ambulance crew arrive. Check for the pulse once every few minutes. It is important that we make an attempt to deliver breaths correctly. Therefore, do not be a deep breather. Breathe as steadily as possible, not as quickly as possible. Do not pant into the victim. Pause to take another breath. And remember to release the nostrils so that the victim can exhale. For chest compression to be effective, they must be performed correctly. Therefore, do not breathe a balancer, nor a massager. Neither should you be a bender or a double crosser.
Not breathing. Move out.
Remember to keep checking for the pulse every few minutes. If the pulse returns, check for breathing. After 1 minute of CPR and every few minutes thereafter, check for pulse. If pulse is present, continue with rescue breathing. Rescue breathing is similar to ventilation. Do a head tilt chin lift to open the victim's airway. Take a breath, pinch the victim's nose, and make a mouth-to-mouth cough. Give a breath of 1.5 to 3 seconds. Release the nose to let the victim exhale. Make sure you see the chest rise and then fall. Deliver 1 rescue breath every 5 seconds. To keep track, count. After 1 minute or 12 cycles, check for breathing again.
Maintain பண்ற டைமிங்
Once breathing and pulse resume, move the victim to the recovery position. Straighten the near hand and tuck it palm upwards under the victim's thigh. Cross the other arm over his chest and place the back of his hand against his cheek. With your other hand, bend his far knee upright. With your palm against the victim's palm and your other hand on his far hip, roll the victim over towards you until he is lying on his side. Make sure that in the final position, the victim's cheek is lying on the back of his palm and the other hand is free with the palm facing upwards. Keep an eye on the victim and check periodically to make sure that he is still breathing